Good morning, everybody. Angel Flener here, coming to you live from inside Angel and Brant, the skin coach. And unfortunately, my camera is a little fritzy this morning, so I'm going to record through my phone. I hope the lighting's good enough for you to see. I just had a couple things beside wishing you all a very happy new year that I wanted to talk about. First and foremost, I'd like to speak to you from an esthetician going to a consumer, and the idea of three things: esthetician, master esthetician, and medical esthetician. Let me give you the scenario first, and then I'll explain from there. Recently, I've had several clients come to me and say, hey, well, I've had microneedling with you, I've had microdermabrasion with you, I've had other treatments with you, but I need different results, and I found a master or medical esthetician that can help me with those results. First and foremost, here in the state of Arizona, there is no such designation or license other than an esthetician. What that basically means is you go to school for 600 hours and you get that license. Once you get out of school, you can work for a doctor, you can work in a med spa, you can work in a resort style spa, or you can own your own business and be an independent contractor like myself. The reason this aggravates a lot of us that are estheticians who have been in the business for quite some time is the fact that a lot of people are using master or medical to kind of gild themselves a little bit better when it comes to a consumer, and consumer confidence is a little bit better when they hear the word master or medical. There are some people in some states like Utah that Utah considers their people master estheticians if they're doing microdermabrasions or using peels. Some states that require you to have longer amounts of time, that do laser and things of that. Those designations are from other states where, for instance, in even a state like Florida, you only have to have 250 hours to be an esthetician, which is a little nerve-wracking. So when you go to choose your esthetician, or you have an esthetician that represents themselves to you, anything other than an esthetician as that word, really do your homework on them. Find out why they consider themselves a master esthetician or a medical esthetician. Have they done over and above the amount of hours? Have they done extra education? Our state here in Arizona does not require continuing ed, which is a shame. And we are also under the license of a cosmetologist, which I'm hoping in this coming year changes a little bit, because cosmetologists in their own right only have a complete week of skincare. Once they get past that week, they are able to buy products from beauty supply houses that affect the skin and the skin of the face and the body. So be very careful about that. The thing that happened to me this morning is I had a second client call me after a year of working with her and working on some issues she had with laxity or sagging of the skin, that she was going to be seeking the assistance of a medical esthetician to perform what's called a Dermapen treatment. This master medical esthetician told the client that Dermapen is not a treatment that's done with microneedling, when in fact the opposite is true. And you're welcome to Google that to get that information for yourself. This particular client is having some issues where I am kind of glad she's seeking out somebody else, because I think she has greater expectations than what I can offer. I have a tendency only to tell people that I can affect up to 80% of change in the skin. The rest you have to do on your own with other treatments. And if you want something that's out of my scope, I would be happy to send you to somebody else. The thing that's so disruptive to me is that this other esthetician used the word Dermapen, and another buzzword in the industry is called PRP, or plasma-rich platelets, which is a treatment that should not be done anyplace else but the inside under the controlled direction of a doctor, because it includes the extraction of blood and the use of the platelets into the skin, or the injection into the skin as normal growth factor or natural growth factor coming from the body. But that's another discussion for another day. This lady client of mine, I'm sorry, this woman, she was very adamant that what we had been doing for over a year was not giving her the results that she needed. But yet this other esthetician took the advantage of using a buzzword or other verbiage where it talked the client into getting something at a much more expensive treatment than what we had been doing with her for the entire year. So you as a consumer, I invite you, make sure that you're looking at, one, the amount of hours or the amount of education that you as a consumer are due from an esthetician that are doing treatments like this. Here in Arizona, there's a lot of weekend classes where people are just taking and not being bloodborne pathogen certified and so on and so forth. Also, are they a licensed esthetician from the get-go? I know that there are a lot of nurses out there that are offering what they call PRP, where it was nothing more than really aggressive, doing a microneedling treatment, making the skin bleed, and then moving that blood back into the skin and then calling that PRP. That is so far from the truth. Be very, very careful with that as well. There are also, last but not least, estheticians out there that use the master or the medical designation and just take weekend classes, and after doing maybe 1 or 2 treatments on people, turn around and start teaching it to junior estheticians or other people that are not inclined to learn that particular treatment in school. All right, there is no certification for it in the state. In fact, microneedling also is known as a tattoo procedure. Many years ago was called dry needling to help with laxity, and done after medical procedures or surgical procedures when people did have keloids post facelift. In my honest opinion, this particular client does need a midline facelift in order to achieve what she wants, but it's a lot easier for her to keep hitting these Groupon places where people are promising her the moon and the stars and not necessarily really with the concern of the consumer of how much money she's going to be spending, he or she is going to be spending. This particular person was referred to Dr. Ron Caniglia of Scottsdale, who is my choice for a plastic surgeon in Arizona. And a little shout out to him, and you can look him up. But other than that, when you're making resolutions this year to do any kind of changes to your regimen, any kind of changes to your particular skin care routine, I invite you, please, please, please do your homework. You're welcome to shoot me an email. A lot of people do. And I like to send people to different practitioners that I know are credible and will be really able to give you the skinny on what is the proper procedure or the wait time or the downtime and so on and so forth. So in this case, my favorite saying is, don't believe everything you hear and only half of what you see, because you have a lot of people out there that are trying to make a buck on you as the consumer, and what's really happening is they're affecting their own bottom line and not really yours. So with that in mind, happy 2018 to you. If there's anything that I can do to answer any questions, if you post down below, I'll get back to you as soon as I can. Also shoot me an email, skincoachaz@yahoo.com. But other than that, be blessed, stay pono, and always remember to pay it forward. Take care.